And when you're performing the procedure, is it pretty much the same as when you're doing it in adults? Are you doing it through the nose? Do you need to go transoral? Is the device different or it's the same device?
So the device is the same. And again, much of the anatomy is already fully developed in the 8-year-old, although the the orifice might become a little bit higher in the small 8-year-olds with time. So the Clarent balloon has a guide catheter and the flexible balloon goes through the guide.
Yeah. Would you say that that's the biggest difference with kids is just being able to find the lumen of the eustachian tube because of all that inflammation?
The answer is yes. Let me repeat that. Yes, it can be tough to find the orifice sometimes because of all this robust inflammation. And you gently, very gently, just touch it to try to move the tissues around to see if you can find the lumen. And it's so friable, it can just bleed. So yeah, you just have to be a little patient with it in the kids. The moral is go slow with the whole procedure. Just go a little slow, and you'll find the lumen and don't push it.
Yeah, that bleeding really helps you find the lumen then, huh?
Yeah, it can block it pretty well.
Okay. And then how do you decide how long to inflate the balloon?
Great question.
Does everybody get 2 minutes?
No. So again, the duration of the balloon is commensurate with how severe is the inflammation. That's true in the adults. So 2 minutes is the max, but if you got like a patient who's got minimal inflammation, I'll do typically like 1 minute. Sometimes I do 1.5 minutes. Now, 18 and below, I never go above 1.5 minutes anymore because we started getting some patulous kids. They are more sensitive to the effect of the balloon than the adults. So need research on this, but there's no question they are more sensitive. They have more inflammation, but it's more sensitive to the effect of the balloon. So fortunately, I've never had to fix the patulous symptoms that we got. They were self-limited, but it got my attention. So I never go beyond 1.5 minutes in pediatrics, and we've not had any problems since.